I have Dr. Christy Sutton with us. Thank you so much for being with us today.
Thanks for having me.
Absolutely. So, most of my listeners have never been told anything about their iron levels past they're anemic or they're not. Why is iron this silent epidemic?
Well, that's a loaded question. So, there is a large percentage of the population that is undiagnosed. And so, I think that's the big part of the silent part is because it's undiagnosed. But often what happens is people are diagnosed with like a symptom. So, for example, let's say somebody is diagnosed that they have low iron, but they're diagnosed with ADHD. So, this happens a lot in kids. So, they'll be given medication for ADHD when really they could potentially get better just with iron, or if nothing else, they should have that low iron fixed because they can't make dopamine without the iron. So, and then the flip side of the coin is that well, we need iron, and not having enough of it can kill you. There is a also a silent epidemic of people that have too much iron because of multiple reasons. But most of those people don't get diagnosed with having too much iron, and instead they're being diagnosed with the symptoms like liver disease. It can cause liver cancer. It can cause brain damage, cardiovascular issues, diabetes, cancers. Pituitary issues, hormone issues, so it can really be very consequential on both spectrums of being too low or too high. And while the people with low iron are more likely to get diagnosed, but even then often they aren't being diagnosed either because the right tests are not being run or they're kind of being dismissed as not looking at the right range for the tests or just kind of ignoring them happens more than we'd like to really admit. So I think that's a big part of the silent epidemic is just that people are dealing with these issues and they're not being properly diagnosed and treated, and instead they're often being diagnosed and treated with these tertiary issues or just kind of led to live a lower quality life.
Yeah. And I have your book right here, The Iron Curse, with me. And I'm so curious how did your husband's journey start? Can you share with the listeners, the symptoms, how you caught on to it?
Yes. So the big driving factor for why I wrote the book The Iron Curse, which talks about low and high iron, but really spends a bulk of the time talking about high iron, is because my husband was he had undiagnosed hereditary hemochromatosis that was causing multiple issues. One of them was liver damage, and then it was also causing him to have low testosterone because that's something that high iron does. It likes to go to the gonads and destroy the testes and cause low testosterone. And it also likes to go to the pituitary gland, particularly the anterior pituitary gland, which is an important part of the brain that is also like an endocrine, important for the endocrine reasons because it secretes hormones. And it secretes hormones that have to do with many things, but one of them is cortisol. And so my husband developed a tumor that caused him to create too much cortisol because of the pituitary tumor, which I think big part of why he had that tumor was because he had the undiagnosed hemochromatosis that was depositing iron in his pituitary gland and creating a lot of oxidative stress and damage, and then that leads to DNA damage and can lead to abnormal growth and cancer. So he had a pituitary tumor that was causing him to create too much cortisol, and which is called Cushing's. So he had Cushing's disease, and he had to have like a couple different surgeries to finally fix that. And I think it's fixed now. But that was a long process. But in the process of figuring all that out, we also figured out he had undiagnosed hemochromatosis that had been going on for a long time and been really totally neglected by his doctor. And so around that same time, we figured out he had a hemochromatosis gene, actually two, because of just direct-to-consumer testing 23andMe, which is a valuable way to figure out if you have a hemochromatosis gene and some other genes too. And then I got really interested in it as a part of my practice, my clinical practice, because I was looking at genetic testing in my patients and labs and things, and just seeing that this was a pattern I was seeing was there's a lot of people with undiagnosed hemochromatosis. There's a lot of people that have these genes, and they have too much iron, and it's not being addressed, and it's creating all these issues, whether it's joint pain or inflammation or fatigue or just the list can go on as far as what it can do to your body. So, but I got really frustrated, honestly, because what happened was I was sending patients, I would tell people you have hemochromatosis, you've got to address this. And they would often go and get like a second opinion with their primary care or even a hematologist, and they would kind of be dismissed, like, oh, don't worry about it, you only have one gene, or, your numbers are not high enough. And that was then letting this very treatable condition continue causing problems. So that's really was the spearhead for the book.
Yeah, yeah. And I was just about to ask you what the conventional medicine system does for this or speaks about it, or even in medical school. Do doctors learn about this?
Yes, yeah, they learn about it, but they also there's some myths and misconceptions that are out there that are really creating a lot of harm to patients, and so doctors learn about hemochromatosis and the fact that you get too much iron and that can cause problems. Typically, it's thought of as you have to have two hemochromatosis genes, is what they're taught. You have to have two hemochromatosis genes. It's very rare. And that is a myth completely. You can have hereditary hemochromatosis with one hemochromatosis gene, which over 30% of the global population has one or more hemochromatosis genes. So we're not talking about like a new nuanced little, 1% of the global population. And so you can get hemochromatosis with no hemochromatosis genes, which is called non-hereditary hemochromatosis. And really, what the primary tools that most doctors recommend and really is effective is removing blood, like having blood removed. And so a lot of people, they're donating blood and they just are unintentionally treating their iron being too high. So removing blood is a really effective way to treat this, but then there's a lot of other things that people need to know about that can also be effective, which I write about and teach about, which are like not just diet and exercise and lifestyle, which are important because you can influence how much iron you absorb and secrete through diet and lifestyle and exercise, but also there's some supplements that are really effective at binding to the iron, removing the iron, decreasing the iron absorption, helping to go and remove the iron from the tissues, which is a really big problem because, a lot of people get these iron deposits in their brain and their liver and their pancreas and their spleen, and that creates a lot of long-term damage. And if you can remove that iron, then you can really prevent that long-term damage.
Yeah. So, with diets as far as iron, what are your thoughts on vegan and vegetarian versus like a more animal-based or carnivore lifestyle?
So, well, the diets that promote iron absorption are diets are that make you more likely to not be low in iron are animal based, like red meat and shellfish are the highest in absorbable iron. So and that form of absorbable iron is called non-heme iron. Sorry, it's called heme iron, and then the non-heme iron is the vegetarian based, like the spinach iron. So the animal based iron is the heme iron, and that's only found in animal products. So animal products, highest in red meat. Sorry, my dog is wanting to participate.
Clicky.
Yeah, she wants to participate. And so The diet's that's going to promote higher levels of iron is animal based, right? And then the diet that's going to promote lower levels of iron is more plant based. So even if it's like you're eating a lot of spinach, which has a lot of non-heme iron, you're not going to probably get high in iron, and you'll be more likely to be low in iron because that iron in plants is not absorbable for the most part. It's a fraction of the absorption is in the animal base. So the iron that's best depends on the diet that's best depends on the person. If you're a person that tends to be low in iron, then you should, eat more of a high iron diet. If you're a person that is higher in iron, then, you should probably eat a lower iron diet. And that can change in one person over the course of their year, the course of their life. Like a lot of women, they'll be anemic when they're younger because they're menstruating and having babies. And that is a huge strain on iron that makes people anemic, low in iron, and many other nutrients. And so they'll go from one extreme to the other, and then they go through menstruation or they go through menopause, and now they're not menstruating. And, a couple of years later, now they're high in iron. So that means that the diet and lifestyle and, the therapies need to change.
Yeah. And how often do you check or do you recommend checking the iron levels?
Well, I think people need to get a full iron panel every year. I think that needs to be a part of the standard blood work. If you have a problem with iron, like if you have a problem if you've been diagnosed with low iron or high iron, then I think you need to go more often, every 6 months, maybe even 3 months, to see if the therapy's working. People that have been recently diagnosed with hemochromatosis, they have to get their levels checked really frequently because they need to figure out, is it coming down fast enough. So the frequency depends a little bit on the person and what's going on with their specific situation. That but a minimum of once a year. And the reality is that a lot of people, like I'll have a lot of patients that they haven't had an iron panel with a ferritin. They have all of these elaborate labs, but they don't have something simple like iron saturation and a ferritin, which we're talking about $30 here, and they don't have it, and that can be the key, that can be the crux right there. So once a year minimum. Unfortunately, that's not generally a part of the standard um, blood panels that are ordered.
Yeah. Yeah. I don't think I have had my iron or ferritin checked probably
There you
ever.
go. It's time. It's
I
time to do it.
know. Yeah, because honestly, you woke me up a little with everything that could be caused by iron issues, whether low iron or high iron. So, what's the most common thing that you see or that you've read about that people are presenting with, either high iron or low iron?
Well, I it's probably not a fair question to ask me because after writing my book, people with high iron started to gravitate toward me. Having said that, and some people with low iron also. Having said that, before I wrote the book, um, I had more low iron people because I think statistically speaking, the low iron is more common. And to be fair, while I treat both men and women, like most doctors, I have more women patients than men. And there's multiple reasons for that for me. I think being a female doctor, sometimes females are like attracted to you, but so because so many, I do treat men and women, and I have both in my practice, but because the bulk of them are females, females tend to be lower in iron than men. It can happen in men, it's just more rare, and there's usually like an underlying pathological issue going on if that happens. Men tend to have more high iron. It can happen in women. It just doesn't tend to happen as much. They tend to either have like hemochromatosis gene or two, taking iron, postmenopausal, all of those are one of those things going on. Also, men tend to take testosterone. Women take testosterone too, um, especially postmenopausal women, but more men take testosterone, and testosterone makes you higher in iron. So, it can go both ways. I see a little bit of everything. But the good news is that like it's all very easy to diagnose with simple labs and very easy to treat with diet, lifestyle, supplements, those type of things. Blood removal in some cases.
Yeah, what supplements are working for this?
For low iron or high iron?
For high iron.
Okay, so for high iron, the supplements that I see to be really effective and that the research is the most supportive of, I talk about them in my book and workshop. The big one, probably my most, favorite one, uh, curcumin, so the extract from turmeric. So that's really good at binding to chelating iron and then pulling the iron out, and then making it so you don't absorb it as much. It's also really good anti-inflammatory and antioxidant. So that's a good one because there's multiple different parts to dealing with somebody that has too much iron. You want to lower the iron. You also want to try to decrease the iron absorption. So these people are genetically good at absorbing iron, the people with the hemochromatosis gene. So you want to try to decrease the absorption, and there's supplements that can do that, like quercetin and berberine. They can help decrease iron absorption by increasing hepcidin, which is a hormone that is involved in iron absorption. And then you want to decrease the oxidative stress that the excess iron is causing. So then that's like you get a lot of antioxidants, like vitamin E and glutathione, and all of those are important. So, but the ones that chelate the iron, curcumin is really good. I mentioned that. Silymarin, which silymarin is from milk thistle, and that's good for the liver, which is important and convenient because a lot of people that have problems with hemochromatosis have liver damage because iron likes to really store in the liver. And so you can get really high levels of iron in the liver, and then that can dramatically increase your risk of liver cancer, like 200 times increased risk of liver cancer. You'll often see high liver enzymes. And so silymarin's nice because you're kind of killing two birds with one stone, supporting the liver, lowering the iron. Alpha lipoic acid's a really good one because it also lowers the iron by binding to it and chelating it. It's also a great antioxidant that is wonderful for lowering blood sugar, and it's great for neuropathy and nerve damage, which are all issues that too much iron can cause. So there's more, but I would say that, those are some of the kind of more important ones. Dietary wise, a diet high in calcium will bind to iron. So this is why sometimes like little kids are very commonly low in iron because they're eating so much calcium. They're like only eating calcium rich foods for the first 6 months of their life, and then it dramatically they have a lot of calcium in their diet from breast milk and all the things. So yeah, a calcium rich diet will bind to iron and make it lower, or just taking calcium. Taking calcium's not my favorite because if you're already inflammatory, which if you have too much iron, you are inflammatory, then adding calcium to that can kind of create more inflammation. So it's not my favorite to start with.
Yeah, wow, that's really interesting. Do you think our food system is contributing to this at all with all the processed foods and fortified vitamins being put in? Does that have anything to do with
Yeah.
the raised iron or?
Well, I don't know. I mean, it's if you have a hemochromatosis gene and you're like absorbing iron too much, then it's the excess fortified iron is not doing you any favors. Um, I'm not a big fan of the fortified nutrients because they're pretty low quality. It's not like they're getting the high quality stuff and putting it in the food because, that would be expensive. They're kind of getting like the low quality stuff and putting it in there. Um, and actually, there's a couple forms of iron that they sometimes put into the fortified food that can be carcinogenic. So you don't know what form they're adding because they just say iron and they don't say which form. But the yeah, I mean the whole idea of fortifying food and especially iron was because they were trying to treat people with low iron, and there are a lot of people like that. But anytime that we decide to kind of lower lowest common denominator. Let's give everybody this because we're going to treat a problem that only a segment of the population has. There's always side effects where the people who don't have that problem but are potentially at risk for having other problems because of the mistreatment, are now going to have more problems. And you see that not just with the fortification system, but you see that with vaccines, and you see that with putting fluoride in water and all these different things. So it's just the idea that we can treat everybody in a blanket way is bad.
Yeah, absolutely. With all the different angles that could be causing things, I think it's,
Hmm.
yeah. Um, I had another question about your book. I stopped a page here. You talked about skipping mammograms and instead doing breast ultrasounds.
Hmm.
That really intrigued me because it's becoming more of a talk online right now between practitioners, and I'm interested in your perspective and why you think ultrasounds are probably a better choice.
Yeah, so the reason that I wrote that about considering an ultrasound over a mammogram is because um, I personally have very dense breast tissue, that I have fibrocystic breasts, and I personally was told to go to a breast specialist that just does ultrasounds. And then I have also an OBGYN that he's older, and he said, you're making the right decision by just getting the ultrasounds, especially because, you have fibrocystic, um, and not just fibrocystic, but I actually have necrotic tissue because I had a breast implants, and then I had the breast implants removed, and then I had a fat transplant, and the fat transplant often turns into necrotic fat necrosis. So I have a lot of things in there that if I get a mammogram, it's not gonna be able to diagnose them or distinguish them, and it's just gonna say there's a problem there, and then the ultrasound would be the secondary step, which would be able to distinguish between fat necrosis, fibrotic tissue, cystic fibrosis, or a tumor. So I've had multiple doctors that are medical doctors that are, specialists that have told me you're not a good candidate for mammograms because all that's going to do is it's going to radiate your tissue, and then it's just, the ultrasound is the only thing that's going to be helpful. So then the breast specialist really helped educate me on this, and the breast specialist taught me that, and I don't want to misquote this, but what he taught me is that basically the main type of breast cancer that you might be at risk for missing, if you get a ultrasound versus a mammogram, is a ductal carcinoma in situ, which because it calcifies, it calcifies a little bit earlier, and you can pick up that calcification on a mammogram maybe like 6 months before you would pick it up on an ultrasound. Having said that, what I was taught is that the ductal carcinoma in situ, because it's in situ, it's not the type of cancer that tends to kill people because it's in situ. So it's like, in controlled, like in a capsule. And while it is cancer and you do want to have it removed and deal with it, that is not the type of cancer that's like if you miss it by 6 months, it's going to kill you. So what he was saying is um, that just means that once you get in that high risk age for breast cancer, which is 40s, then you have to be more regular about getting those ultrasounds. And his recommendations are a little bit more aggressive than like what I'm willing to go and do every 6 months. I'll get there once a year if I'm being honest, because I do have to pay out of pocket because I refuse to get a mammogram. But because I will not get a mammogram, I can't get an ultrasound done anywhere other than like through there's a couple offices that I know of where these doctors will do the ultrasounds. And I know that there are some places, like there's some buses that will go around and do ultrasounds, and I haven't gone to those because I want the same clinician who is an expert, who's trained in reading that ultrasound, to look at it every time. So, like, I've had the same medical doctor, breast specialist, looking at my breast ultrasound for, years now. And he's really good at it. And I don't want to go to somebody else because, if they miss something, then it's just not worth it. So I pay out of pocket. It's another expense that I have to pay for, and I'm not excited about it. But the alternative is that I'm getting my ultrasound. I'm getting a quality ultrasound, being read by a trained quality physician, and I'm not irradiating my breasts. And so mammogram machines, they create a lot of oxidative stress in the breast tissues because um, they they really have to get a very clear image. And to get that really clear image, they are not going to have as a really great filter on the mammogram machine. So, like for example, if I get a spinal x-ray, they're going to put a filter on there because I don't have to see the details quite as much, so they can put a filter to take out some of the scatter radiation, and still get a good enough image. With a mammogram, they have to take that filter off for the most part so that they can get a really clear image. So that's a lot of radiation going into your breasts. And if you do that year after year after year, and some people have to do it more than once because they have an abnormal finding, and now it's like we have to do it more. It's like I think it's fair. I think it's a fair question to say, at what point in time are we no longer screening for cancer and we're actually causing cancer? And that's a question like nobody can answer. There's no way to answer that. But mammograms emit ionizing radiation. Ionizing radiation causes cancer. So I just think it's an important thing to talk about. And then the other thing, as long as we're going to talk about breast cancer and breast mammograms and everything, and that if you are going to get a mammogram, I'm not saying don't get a mammogram. I'm just saying, like, think about it. And what I don't want women to do, I don't want women to say, stick their head in the sand and I'm not going to get any imaging, because that's not right either. We do have an increase in breast cancer going on in this country, and early diagnosis is crucial for being able to survive cancer. Having said that, be mindful about what type of treatment you're getting and the side effects. And if you are going to get a mammogram, really increase your antioxidants ahead of time. And I'll even, sometimes recommend people, I'll give them like a topical glutathione. Glutathione is a really good antioxidant, and they'll just, put that all over their breasts ahead of time. And after, to really saturate the tissue with antioxidants, because if you think of ionizing radiation from the mammogram machine as like these bullets that are firing off rounds at you, then the ionizing radiation, then the glutathione is the antioxidant that's like the bulletproof vest.
Wow, yeah, that's really good to know because I'm approaching the age where I'll have to decide, and I've been reading so much and seeing so much, and we do have to have the conversation of, is it causing cancer? Is it, because what else could explain the rise in breast cancer? It's environmental, but what?
Yeah. Well, I think there's more than mammograms. I mean, mammograms, we need a better technology is what's really going on there. Mammograms cause ionizing radiation specifically to the to the breast tissue, which can cause breast cancer. But I think the other part of why we have a rise in breast cancer is because of the excess of estrogenic hormone, chemicals, whether it's BPA or phthalates or, whatever chemicals that are estrogen-like that are creating this toxic estrogen dominant, environment. The same reason that, girls are starting their periods earlier, because of all the excess estrogens, which largely comes down to the excess plastics. But it's not just the plastics, it's also, all the chemicals that people are like bathing their skin and their body in. And it's just, we have so many different things going on, but it's the estrogens, it's the ionizing radiation, it's not having enough antioxidants. It's complicated, but it's certainly on the rise.
Yeah, yeah. And so, on this same subject, a little bit different, what do you think about colonoscopies?
So, well, okay. When I first graduated from college, my undergraduate, I considered, because I have Crohn's disease, I considered going into medicine as a gastroenterologist. And so I worked for a couple of years or so as an endoscopy tech. And I was basically assisting with colonoscopies and EGDs and various scope procedures. And so as somebody who has like watched a lot of colonoscopies and EGDs and had a number of colonoscopies, um, because I have Crohn's, I think for the most part colonoscopies are really good and essential. You know, while there is a very small percentage of people that might have a perforated colon or some issue, more so what you find are people that they're catching colon cancers early and removing them so that you don't have this metastatic terminal cancer. So I think they are good, they are important, they are not just screening, but they're also a way to treat, which I think is a more valuable tool than like some of the blood tests or stool tests that look for cancer. I think the better option is just to get the colonoscopy if you can. And just, if you're going to get a colonoscopy, you might as well get an EGD too to look at your stomach and your throat and make sure there's no issues there. So yeah, I don't really have too many problems with that.
Okay, okay. And how long have you always had Crohn's? Were you, as a child?
Yeah, I was diagnosed when I was 16.
Okay.
So I attribute a lot of my getting Crohn's to having what I believe was undiagnosed celiac disease at a young age. And my father is a medical doctor, and sorry if you hear this, Dad, but I think a big part of why I think a big part of why I have Crohn's is because I had undiagnosed celiac disease. I have a celiac gene, and I was being given a lot of antibiotics for digestive issues when it wasn't a bacterial issue. It was a, celiac type issue. And so at 16, I got diagnosed. They thought I had appendicitis. I had a lot of stomach pain, all this horrible issues. And then they go in to do the surgery and they take out the appendix, which was fine, but they took it out anyways. And then they also take out the last foot of my small intestine and diagnose me with Crohn's. And then, um, so that was a long time ago, that was like 1997, maybe? It was a long time ago. So, they didn't have as many drugs back then, so they put me on Azicol, which is kind of like a glorified NSAID, and didn't really do that much. And then I tried to I didn't really want to be on medication for multiple reasons, and I tried to kind of figure out what was going on. And I had a friend that gave me this book that Breaking the Vicious Cycle, which was like, the main book back then. There were not a lot of things out there. And I stopped eating grains and gluten. That seemed to help. And I hadn't really identified it as like gluten specifically. It was more so just cut out the grains. Um, and then I kind of would get better and then it'd get worse. And then I went to and then I had a really bad issue where I started having a lot of problems around 20. And I went to actually this chiropractor in Austin, Dr. Bandy, who I love dearly, and became a chiropractor because of him. And he was like, "You have pellagra, vitamin B3 deficiency, which is actually very common in people with Crohn's." So I started taking the vitamin B3, and like all of my diarrhea stopped, which was significant because when I went to see him, I weighed like 70 some odd pounds in my 20s because I was so emaciated from like all the diarrhea and everything. So I went and I started taking the vitamin B3, and I like the diarrhea stopped that day, and I slowly, regained my weight and my health, and kind of went through various different phases of learning about digestive issues and whatnot. And with Crohn's, I don't have all the answers. It's a very complicated, and mine's more complicated than most because I had that surgery when I was younger. Um, but I think, what I what I've tried to kind of learn from that is the importance of diagnosing people early with having a celiac gene and having celiac disease or having a predisposition to having celiac disease, because it is an autoimmune disease that can turn into other autoimmune diseases, whether it's Crohn's or MS or RA or type 1 diabetes or psoriasis. All of them bad, all of them terrible, all of them hard to manage, Hashimoto's, you name it. So, and that's something that I also look at closely in terms of genes and stuff with people, because over 30% of the global population has a celiac gene, and that can cause low iron. That's one of the first often symptoms with people is low iron, and then people are just given iron rather than being treated for the underlying problem that's causing the low iron. So, yeah.
And so, is that what brought you into wanting to be a chiropractor when you were
That
getting
was a
treated?
big part of it. Yeah, that was a big part of it. Before that, now I mentioned my father is a medical doctor. So I heard a lot of like bad things about chiropractors growing up because when my dad went to medical school, he was being taught like a lot of just bad information about chiropractors. Um, I think it was in the 70s. There was this American Medical Association, the AMA, which is, medical doctors join the AMA. They created the Committee on Quackery. And the whole point of that, they literally called it the Committee on Quackery. And the whole point of that was that they were like intentionally lying and like putting out just lies about chiropractors. And it was basically to try to destroy our profession. And so a group of chiropractors sued them, and because they would like put out misinformation into the medical schools and into the public, and it's just lies. And so a group of chiropractors sued them, and they actually won because the this committee on quackery was so blatant and bold as to have a note keeper, and the notes landed in the hands of the chiropractor's lawyer. So the AMA, they lost, but they just had to pay a fine. Like the damage was already done. They'd already disseminated all these lies that have been, passed down for generations. So even to this day, like medical doctors, they think really poorly of chiropractors and a lot of people. And, to be fair, I'm sure there's some really bad doctors out there that are chiropractors. There's also some really bad doctors out there that are like, dentists and like surgeons. And like, let's be real, every profession has, the rotten apple. But my father was going to school around the same time that that misinformation was being like intentionally put into the medical schools. And so he had a lot of bad things to say about chiropractors, which is what I grew up hearing. And so when I was really sick, somebody recommended that I go to this doctor, Dr. Bandy, and I was like, okay, he's a doctor. And then I went to the appointment, I realized he's a chiropractor, and I almost didn't go because I was like, oh, what a waste, what a waste. And then he ended up being so great, and then he helped me, and then I'd go back to him for something else, and he'd help me. And meanwhile, I'm like, go to the medical doctor, and it's just, I didn't feel like they're getting to the root of the problem, and it just felt defeating and deflated and kind of like this, sterile environment. And then I'd go to the chiropractor, and I would walk away feeling so great. And so I decided to become a chiropractor, and here I am.
Yeah, wow. I'm really interested because I honestly don't know the whole scope of chiropractor versus medical doctor, and I'm sure my listeners also don't. Can you just give us a little like comparison of chiropractor versus the conventional medical system?
Yeah, so it's a little bit confusing because it's a state by state basis. So I don't know that that's the same for nurses and doctors. like medical doctors, but for chiropractors, some states have a much more limited scope than other states. So, for example, I'm in Texas. So, my scope is, I can diagnose and treat musculoskeletal conditions. And I can, in the process of that, I can diagnose other issues and refer out, for example, hemochromatosis. Hemochromatosis creates a lot of musculoskeletal issues. And so I can diagnose it so I can run labs, and I can give supplements to help with like the pain and things like that, the inflammation. But I have to refer to a hematologist so that, they can have it properly treated and have blood removed, which I think is funny because a lot of times the hematologists don't treat it properly, but, I try. And then, I can do, like I do dry needling to put needles into the muscles to try to help the muscles relax. And because of, just, I think my experience and the breadth of my work, I have a lot of people that come to me for things that you wouldn't traditionally think of as like a chiropractic type of thing. But, I always approach it and the chiropractic philosophy, which is trying to get to the root of the structural, chemical, and emotional issue. Okay, so Texas, it's structural. I can do labs, musculoskeletal. Other states are more limited. In New York, they can't even run labs. Florida, it's like, they can do injections. And, New Mexico, they can do injections. So at the end of the day, what it is you all of these different, whether it's a PT or a chiropractor or a physical therapist or a physician's assistant or a nurse or medical doctor, all of these groups have their own kind of like political governing bodies that everybody, they're always trying to recruit you to give them money. And those governing bodies are like, it's a turf war at the Capitol. So it's a turf war at the Capitol trying to like change the writing to we can do this, but not this. And the medical doctors have the most turf, and they always have, and they always will. And sometimes they try to like kind of push us out. And you've probably seen that as a nurse. Have you seen that as a nurse?
Yeah. Yeah.
Yeah.
And
So tell me about that.
I'm just learning about when you mentioned how your dad went through that chiropractic push, just how Rockefeller went in the early 1900s and did the same thing to naturopaths, homeopaths. When I was in nursing, anything outside of medications was just bonkers, Oh, you're taking that and you think that's going to help you? No,
Mm-hmm.
Insulin is what helps you. Or just
Mm-hmm.
a very closed way of thinking in the medical industry. And the way that they train you is very much to be indoctrinated to push pharmaceuticals. And it must have changed in the early 1900s because before that, chiropractors practiced their own, naturopaths, homeopaths. So I'm very interested in that.
Well, there is, I don't want to get my facts wrong here, but there is a storyline that goes that if it wasn't for the 1918 flu, like the chiropractors might be, you know, gone. Because the storyline goes that the 1918 flu, there were so many people sick and dying, and they just, they didn't care anymore if you were a medical doctor, or it was like what the medical doctors have to offer is not working. Go to the chiropractors, and sometimes they'd get better, maybe because they were going to get better anyways, maybe because they got a thoracic adjustment and were able to breathe better, or an adjustment to like calm their nervous system, which calmed their immune system. A big part of the 1918 flu death was that they had this over immune reaction where people just died very quickly because it was such an intense immune response. So there is this kind of storyline that if it wasn't for the 1918 flu, we might be gone as a profession. But, we theoretically saved a lot of people during that time, and like the patients really came to bat for us. And that's, happened for as long as I know. The patients ultimately come to bat for us. Because, if something really works, and it it works and you can't take that away. Just like, acupuncture has been around for a long time. If it exists, it persists. Like if it works, it's going to keep working and people are going to keep doing it. And maybe they'll do it underneath a different name or change the marketing or whatever, or different, license, but they're going to keep doing it. Um, Chiropractors are not, I know what you mean by like the medical doctors or the medical profession is very indoctrinated, and I see that. I think that's easy to see in the current world we live
They,
in.
yeah.
Some more indoctrinated than others, and I think, there is like a movement to be less indoctrinated, but where it's just when you're starting from zero, it's, you have a long way to go. Um, Chiropractors are not indoctrinated. If anything, we're like, maybe need to like be a little bit more indoctrinated. Um, we uh, we have a lot of different opinions and theories, and how things work and how they don't work, and it's like as much an art as a science, which I think anybody that's a clinician um, will really at some point in time realize like this is as much as art as a science if you're dealing with people, because everybody's so different, and what could work on 10 people will not work on the next 10, and you just at some point in time have to like try different things, because if it's not working, well then it's easy not to be indoctrinated. Like it's hard to keep me indoctrinated if what you're telling me to do is not working, or like you're not going to be able to like make me believe it's going to work if I physically am trying to like make it work and it's not working. Then it's like not working, let's try the next thing. So yeah, I mean the chiropractors we don't have now. I think there are some states, maybe New Mexico, where like they can prescribe certain drugs. To be fair, I would like to be able to prescribe muscle relaxers and like a couple things. I would like to be able to, some of like the real strict chiropractors are going to be like cringe by me saying this. I would like to be able to prescribe like a couple things, but it's just not in our scope. In some states, they can prescribe like a couple things, and it's a turf war. Basically, everybody's just trying. In Texas, we have so many medical doctors; they have so much money that they can fight the chiropractors. Trying to limit our scope as much as possible.
Wow. Do you find that you're able to heal things that people would normally take medications for, where you don't have to put them on anything or suggest that they go on
Well,
anything?
okay. I mean, I have to be really careful how I answer that because, um, for example, like it is not within my scope to treat digestive disorders. But if somebody happens to come, and I'll give you an example. Okay, so I had a patient come into my office and he's here for back pain. He's got this back pain. I'm working on him. It's not really getting better fully the way I'd expect. And then in the process, because he didn't fill out his patient paperwork like he should, because this is a man that men often do this. They give you like empty patient paperwork and then you don't really know what's going on and you just kind of figure it out. Um, they're like,
Detective.
here's my name. So then like in the process, and of course he also arrives like, 20 minutes late to like an hour appointment, and like he hadn't filled out his paperwork. So like, okay. So I'm working on him, like see him a couple of times doing, dry needling, whatever, just trying to get him better. He's not improving the way I expect. And I'm like, okay, so have you done 23andMe? Do you have any blood work? And he's like, yeah. So pull up his 23andMe. He's got a celiac gene. Okay, that's interesting. And then he's like, Function Health. All these people are going and getting like all of these labs, and then they're not doing anything with them. It's just like, I have all of this valuable information that now I'm just gonna like put and store in the cloud for the next 40 years and not tell my doctor about. And so I'm like, okay, well, let's look at that blood work that you just paid like $500 for, and shows that you have, ANA positive, which is ANA positive is, can be positive for lupus, Sjogren's, scleroderma. Okay, yeah, so he has kidney issues, he has ANA positive, he's got some other issues. Like, okay, so you have a celiac gene, you have ANA positive, you have some kidney issues. Like, I think this low back pain could be coming from your kidneys being basically, because with lupus, your immune system's attacking your kidneys and other things, and so it can create low back pain. I'm like, okay, we'll keep working on this low back pain, doing dry needling or whatever, but I really want you to get on a gluten-free diet. You have this actually had two celiac genes. You have two. It's like, okay, you have two, not one. So he gets on a gluten-free diet, and his back pain gets so much better. Um, and so, and then he tells me, and my digestive system is better. And it's like, well, I didn't even know you had a digestive problem because this was your paperwork. And so his digestive system is better. It's like, okay. Yeah, he's like, yeah, I'm having a lot of problems for a while. It's better now. I'm like, okay. So like you probably have like celiac disease, right? And it was manifesting in, joint pain, low back pain, and now it's all better. And he's like, thank you for fixing my back pain. You're such a great chiropractor. I'm like, I think it was the gluten-free diet that fixed your back pain. And, am I technically out of my scope there? I don't know. I don't think so. I mean, I did tell him to go see, primary care doctor, which he doesn't have because he's a guy with paperwork like this. So, um, I did refer out, but a lot of times you refer out and people don't go where they're supposed to. And so what do? Do you abandon them and just say, I can't help you? It's hard.
Yeah, I couldn't imagine.
The struggle is real.
Yeah. And my struggle with the conventional side of it was they didn't even try anything the way you do and the way it sounds like chiropractors do. They just, uh, we don't know what's wrong, but here's a pill. We don't know why, but here's a
Right. Well,
pill.
here's, I think, where chiropractors are really strong. We're like willing to do the scientific process of trial and error and to try things and see if they work. And ultimately, that's, I think, a part of medicine that and healthcare that is really missing. This, I understand the need for, you know, double blind placebo research and all of the things. And I, you know, want every medication out there to be like fully researched. Um, Having said that, a lot of what I see as far as getting patients better is like, let's just, try this diet or this exercise or this supplement, or, let's just kind of be scientific and let's just see if this changes your labs or how you feel, rather than just saying, well, the research shows that we're supposed to do this. And it's like, um, and I think part of it is I don't take insurance. And so I have a little bit more flexibility to be like, I can just try things and I can order things if I want. And I don't have my hands tied, behind me, metaphorically speaking. But that is a part of the problem is the insurance model is kind of dictating care more than the doctors in many ways. And I don't have that because I don't take insurance. But, there's other things like I don't have because I don't take insurance or, don't have the ability to do them. So yeah, trying things is important, especially in healthcare.
Yeah, absolutely. So, how did your dad feel about you choosing chiropractor versus medical doctor?
He wasn't really supportive of it. He was, I think it's just kind of being a parent. I do empathize and understand. I think, as a parent, you know how things can get hard. You know how, having a family, life gets expensive, things happen, and he wanted me to like have that salary and benefits. And I get that. He wanted me to be, a pharmacist. And I get that. And I don't like have any ill feelings towards that. Um, I think now he's at peace with it because it's been going on for a while now. And he's seeing that, I have a good career and, I'm able, it's not like I'm, asking him to help me out, So I think that's a big part of it. I think, parents all just want their kids to be able to, be self reliant, be able to take care of themselves, all those things.
Absolutely. Yeah. And are you happy with your I like asking, are you with happy with do you think your purpose from when you were diagnosed with Crohn's, do you feel like you're fulfilling your purpose?
Um, I think I've made a meaningful impact in a number of people's lives and health. I think, you know, I can see that. I think also as a clinician, you often also see the failures, and that can be difficult sometimes just because, you want everybody to get better and you want everything to work out, the way that you want it to work out. And it doesn't always work out that way. Having said that, the approach of let's just try to move the needle to making your life better and healthier is still an approach that's worth doing and making meaningful measures, even if it may not look the way that you want it to look. And that's sometimes hard to measure. Like part of the issue with alternative care and holistic care is that you don't get to be the hero and be like, oh, I saved you from cancer because like I cut it out of you. It's like, what if we just helped you prevent having that disease? And then there's nothing to cut out. But you don't get like insurance doesn't pay for that. There's no like proof. So um, yeah, I mean, I think I still have. I would like at some point in time to maybe write another book about the celiac piece. Um, but I don't know. We'll see.
Yeah. Yeah, it's a lot. I admire you for everything you're doing, and your book
Thank
is
you.
amazing. And where can my audience find you?
So I have a practice in Dallas, Texas, and I have a website, drchristysutton.com, and they can find me there. Or I have an Instagram account at Dr. Christy Sutton, and I have a Facebook account and a TikTok account. So all of those.
All the social media. Well,
Yeah.
thank you so much for joining us
Thank you.
and being so vulnerable and sharing that. I
I
really
appreciate
appreciate
it.
it. Yeah. And if you guys enjoyed this, please share it with a friend, share it with someone who you think would benefit from it, and I'll see you guys next time.